a new talk, and maybe you come to my other talks where I go over like specific lifestyle. This is the only people I gave this talk to was a family practice resident at Summit. Because it was more like, how do we think through the process? And I figured this would be applicable to you. I'll kind of dumb it down a little bit, of course.
No, don't bother.
He has more faith in us.
We can handle it.
But yeah, it's a good one because what it really does, it makes you think about how do we approach our health and our conditions from a thinking process. I think when you begin to understand conceptually how your health works, you'll be able to make some changes for yourself that are pretty straightforward, which make a difference. So you guys have the handouts. We're going to be referring, this is really an important one. I created this one. I know it seems kind of weird, but it's actually not as complicated as you might think. We have a few more up there if you like. And a lot of the slides are essentially going to kind of center around that handout, okay? There's the physical stuff is on top, and then the biological is on the bottom. But we'll go through that.
And will you post this on your?
Yeah, this is actually being recorded now. It'll be on my YouTube channel.
Perfect.
Yeah, so this is pretty much the overview. So we're going to first talk about, what traditional medical evaluation typically looks like, which we all are aware of. It's not always bad, but just give you an update on that. And then what is functional thinking, which is what we're talking about today. And then we're going to go through the factors to consider when you think about functionality, like, for example, physical stress load, all these things up here. We'll go through them. Don't worry about reading them. And then we're going to go into some of the more fundamental biological response to enhanced physiological, I call it enhanced physiological stress. We'll talk about that in a bit. And then we'll look at the end result of that, and then how you then approach chronic health challenges. And I'll give you some examples of like certain type of scenarios where how we would approach it fundamentally, from a very fundamental perspective. And then some concluding thoughts. Okay. So traditional medical evaluation is kind of more what we are used to seeing on a day-to-day basis. What traditional medicine attempts to find is a diagnosis. And the idea about a diagnosis, as a physician, what we try to do is when we get a diagnosis, there's actually a code to that diagnosis. I get it called ICD-10 code. If I say, rheumatoid arthritis, for example, it's got a code assigned to it, which then I can then put down on paper and then be able to code and bill for specific business stuff. So we use that for billing and logistical purposes. When you have a diagnosis like that, it doesn't always tell you what the cause is. It just gives you a name of the diagnosis. And sometimes that name is meaningful, and sometimes it's not really meaningful, but it gives you a name to it. And it matches a particular set of presenting signs and symptoms so that a particular corresponding treatment plan can be implemented. And the treatment plan may not necessarily be attacking the actual core issue. It may just be looking at a symptom approach. For example, if I have osteoarthritis of my knee, if I give an anti-inflammatory, I'm going to feel better, that's great. But it doesn't get to go to the core issue as to how I developed it in the first place, going the 10 steps back. That's what functional thinking is. The traditional evaluation, again, doesn't necessarily base its medical assessment on systems, biology, or physiological disruptions. It doesn't say like, oh, this diagnosis is because of this particular physiological disruption. It just gives you the name, okay? The treatment here, in this particular situation, is more commonly palliative. Means that it just makes you feel better in many cases. Doesn't mean it doesn't make a difference, I'm not going to say that. But in most cases, like if I have pain or fatigue or whatever, it's kind of palliative. It doesn't get to the core issues. And it's less restorative and less curative, of course. There are some exceptions, of course, to this rule, as you probably know. But this method is valuable. It's best applied mostly in the acute setting. If I go to the ER and have a stroke, I want to know it's a stroke, what am I going to do for it, and there's protocols. Like if you look at Kaiser Permanente, Kaiser Permanente is kind of like the king or queen of what they call box medicine. Like if A, then B, then C, then D. If you cannot fall in that box, they'll go, oh, I don't know what to do, right? But that's okay when you come in for a stroke. That's okay when you come in for a heart attack. That's okay if you have a major seizure. Those are great because it takes you out of harm's way. But once you get past that, you got to say, okay, now what are the core issues that are driving that problem so I can make a change long term? So functional thinking. So functional thinking, that's kind of a term that I kind of coined, but functional thinking emphasizes the analysis of the factors that contribute to the abnormal physiology that's taking place, right? Rather than the diagnosis. So I might say, someone might say, I got IBS, irritable bowel syndrome. Okay. So we might say, you have abnormal microbiome and leaky gut, which causes this and this and this and this and this, right? We're trying to understand what's actually happening, not just giving you some weird name. That's the idea. So that's what functional thinking is. Functional thinking takes into account the notion that any one condition can be caused by a variety of different factors. No one person is the same. For example, if someone has high blood pressure, which is a very specific condition, not all high blood pressure is the same. You know, for example, let's say Lynn has high blood pressure because she's stressed, or let's say Roy has high blood pressure because he has some other issue going on. It doesn't matter. The idea behind it is that you may have high blood pressure, but the way I approach you is through a functional thinking lens. Now, if I got a blood pressure of 200 over 110, I really don't care about this core value. I want to get you down to 175. I want to get you safe. That's where the acute medicine takes it really good. Gets you safe. But once you get into a safe range, now you take a deep breath. Okay, now how can I evaluate my particular issue, not just looking at a global perspective, right? So functional thinking drives to determine what factors precede the onset of the condition. We call this antecedents. So for example, if I have, let's say, chronic fatigue, right? And then someone might, I say, okay, when did that start? And they'll say, well, it started about 3 years ago. I may say, what was happening in your life 6 to 12 months prior to that, or before that? Well, you know, I was really stressed and I lost my job and I was going through a divorce. I go, okay, that's gonna help me understand. Or, you know, 3 weeks before I got mono. I got a viral syndrome and I got a process that happened that created chronic fatigue. Okay, that helps me to understand what some of the drivers of that problem are, right? So it may not have happened on the same day you developed chronic fatigue, but it may have happened before that led you up to develop that process. That's what we call antecedents, what happened before. So functional thinking tries to determine the specific triggering event. So for example, antecedent might be, you know, I was really stressed for 6 months. I was just stressed, and so I'm kind of brewing. All this stress is going on, all this change is going on. And then I got sick. And then on this day, I got a bad mono, I got a bad flu. We went to a party on New Year's, and I got a horrible flu, and I just didn't recover, right? Where I normally would recover. You go, oh, that's interesting, why didn't I recover, right? Well, because maybe there was all this other stress going on that was killing you in the process, and then all of a sudden something hits you, that, you know, then it became a problem. So that's called a triggering event. Not everything has a triggering event, but a lot of things do. And then functional thinking strives to determine the specific factors that continue to perpetuate. So we have antecedent is like saying, okay, what's happening before that might put me at risk? Okay, then what triggers the event if there isn't? And then now what's happening that's perpetuated? Well, now I have fatigue, and I can't sleep, and I can't exercise, and I got a leaky gut in my gut. So okay, so now you're not sleeping, and you can't exercise, making it worse. So what is going on that's perpetuating the problem? And that's why that little chart is going to help. Because you guys, one exercise I'm going to have you guys do is I'm going to have you go through this and say, which of the following apply to me? You will be surprised how many you will check off. So, and the treatment in this model, as we just talked about now, focuses on removing the relevant long-term treatment, not acute, but long-term treatment, on removing the relevant causal and aggravating factors in order to help restore more normal, balanced biology, okay? And that allows once the body gets into a more normal state of physiology, as best as it can, what does it do? It wants to heal. The body will finally find a way to heal, because the body really is pretty amazing. It does try to heal and repair as much as it can, but if it's spinning out of control and is feeding itself, you know, like a feed-forward machine, it just gets, it gets like a toilet bowl ring. It just keeps going and going and going. We have to cut that out as much as we can. So this approach focuses more on that as opposed to just more of a palliative in nature. Not that we never do that, we do, but we'd rather get to the core issues as much as we can. So now, the first thing is, what factors do we consider in session functionality? Okay. So when I thought about this, I said, what are the categories, boxes, that I think are really important in determining every single chronic condition that we have? You can add everything that we have, doesn't matter. It'll actually be, the causal or aggravating factors will be in one of these boxes. We're going to go through each box without fail. Find me one. So physical stress load, we'll go through each one. Physical stress load, medical stress load, nutrition quality and gut health, activity and exercise, environmental toxin load, genetic predisposition, that's why it's there, sleep quality, and emotional stability, right? If you look at that and go, that's probably about right. Is there anything else you can think of that's not in the category? Nope, not really. I'm not looking at hormones are a secondary effect. Hormones are a physiological response. I'm talking about factors, environmental things that we do, factors. So physical stress load is like, the things that affect our physical body, our musculoskeletal system. They seem kind of odd. So for example, if someone has physical abuse, the physical effects, physical trauma, musculoskeletal issues, chronic pain, because those things can create a lot of inflammation, a lot of processes on their own. A lot of us have osteoarthritis, we've got back issues, we have this and that. That physical stress can create, in its own right, can create a lot of physiological stress. We'll talk about in a minute what that means. So any of those things are really important. Medical stress. So for example, if you have ongoing medical illnesses, the big one is how many medical procedures did you have? Those medical procedures may be very important, but they create some distress. They create a lesion. They create a process. If I have back surgery, it's great, but I also had to have an incision. I have to have a disruption of tissue. I have screws in there. Not that you shouldn't do it. I'm just saying, but you realize that could be a little bit of a factor that is ongoing. And the big one is polypharmacy, medications, right? A very big one. Am I on a statin, for example? Love statins, they're great drugs, but they can deplete CoQ10, vitamin K2, a variety of things. Am I on a antacid medication? Why is that a problem? Well, that can disrupt the microbiome, give me SIBO, that can actually create deficiencies in magnesium, B12, iron, just to note, right? That's how you should stop them. So polypharmacy can be another load. Yes, it may have an effect, but it may have a negative consequence that needs to be considered. That's all. Now this is the big one, nutrition quality and gut health, okay? So when we talk about our nutrition talk, which I think we're going to talk about later, okay, in another talk, these are the factors we're going to talk about, right? So when we look at nutrition, it's not just about the macros, it's everything more the nuances of nutrition. The big one is excessive glycemic load. What is glycemic load? It means a sugar effect, right? If I eat a certain food, how much does it create a sugar spike in my blood? That sugar spike in my blood can create a problem with not only diabetes, but inflammation and all that. Too much sugar causes damage to cells directly. You guys get a blood test periodically, maybe, called hemoglobin A1C, right? Hemoglobin A1C is an important marker of blood sugar sticking to red blood cells. So if I say my hemoglobin A1C is 5.5, that number represents the 5.5% of your red blood cells covered in sugar. That's what that means, 5.5%, right? So that means my red cell lasts, 190 days, 120 days? So that's a good marker of 3 months. So the more sugar that's been accumulating on that red cell over time, it sticks and stays there, that's a good marker of blood sugar over 3 months. So that A1C is I think is one of the more important blood tests that we should be getting. They often don't do that. They do fasting blood sugar, but really A1C gives you a better long-term look over the period of 3 months. Hemoglobin, HbA1c, that's what it's called. So the glucose aspect, so there's a difference between an apple and the soda. We all know that, right? Even the Mexican company. But I mean, because what it does is the nutrients in it coupled with the way the fiber is, the way the blood sugar goes up, the way it's maintained, and all that stuff. So that we often know is important. Also, we talk about saturated and trans fats. There's a lot of controversy on saturated fat. I think we have now come to the conclusion of what the real truth is. Trans fats are saturated fats that have been overheated and they've shifted their bond, they've shifted positioning. That trans fat, which is carbon, hydrogen, that trans fat is now becoming very unstable and very hard to break down. So when we take a heated vegetable oil or a heated oil that's unstable, now becomes stable, an unsaturated fat, we take that in and we can't break it down. It gets in our cell membrane, it sticks there, it's hard to digest and break down, and it creates instability. So we know that trans fats, which we're now reducing in our society, can cause a lot of heart disease, inflammation, and all that. Saturated fat. Not all saturated fats are the same. Saturated fat basically means if I have carbon, and I have all the hydrogens around there, the maximum amount of hydrogens, that means they're saturated. That means there's as many hydrogens that can go on the carbon exist. There's no double bonds, it's one single bond. Okay. So if it's a saturated fat, there's this notion of even chain and odd chain. An even chain would be like a C16, 16 carbons. Even chain fatty acids are actually inflammatory, and promote cardiovascular disease. However, odd-chain fatty acids, C15, C17, like fatty 15, actually reverse and are the opposite. They actually are anti-inflammatory, pro-longevity, and pro-health. So like, well, how do we know? Well, the thing is, if I have cheese and I have milk, guess what? I have all of them, right? But the ones that have the most healthy fats so are the like the goat cheese. For example, goat cheese is more than milk, right? So goat cheese probably has a lot more C15 and C17 than any other. That's why dairy is kind of in the mix, but it's a little more nuanced. I would say, I mean, non-fat milk seems kind of worthless to me, but it kind of, it's just more of a beverage. But if you have like, if you're going to have whole fat, there's benefits to it, but understand that if I have whole milk, especially as an adult, maybe not as a kid, as an adult, there's a potential that it creates more inflammation because of all the even chain fatty acids, which by far outnumber the odd chain. It's about 1 or 2% of that fat in milk is actually odd chain. So it's very difficult. If you look at the blue zone people, they have the highest C15 levels, very high levels of C15, which is protective. But we don't. And probably it's because of the types of dairy they have, other things that they have, the way they process it and prepare it. Is it grass-fed, not grass-fed? All that makes a huge difference. But just understand that we don't need to vilify dairy, we just need to understand it a little bit more nuanced. That's the idea behind it. Vitamin, mineral, antioxidant intake, of course, is very important. If you don't get enough vitamins and minerals, especially with the soil being stripped of minerals in America, then we're going to lack those things, and we're going to have some nutrient deficiencies, which creates a stressor on our body. Essential fats, that's really important. Omega-3, omega-6, and now actually omega C15. You may have not heard what is C15. We know the omega-3 is essential. Essential means we have to take it because we can't make it. We know we have to take omega-6 because we can't make it. But I never heard about C15. That's a saturated fat. Like I was telling you earlier, it turns out that is very difficult for us to make. And it turns out when we're deficient in that particular nutrient, we have a lot more problems. We have more metabolic disease, we have liver disease, we have fatty liver, we have a variety of things that occur as a result of insufficiency. Do I think it's an absolute necessity of it? No, you can probably live, but it probably won't do as well. Same with omega-3s. So getting a very healthy omega-3s and less omega-6, you want to have some omega-6, is really important for just overall inflammation control, over mood health, over just overall wellness, cardiovascular health, really important. Protein intake is important. People always think, oh, we should be vegan. Not necessarily. We're omnivores, but we should probably think about the type of meat that we eat. If we're going to have red meat, that's fine. Have it, make it grass-fed, make it lean. Probably better than having some, really fatty, horrible corn-fed meat. So I think that's important. But really focus more on chicken, poultry, fish. We know that if you look at longevity studies, people who have fish have a little bit more higher longevity. People who have like chicken are probably neutral. And people who have beef, red meat, maybe a little bit lower, but I guess it depends on the type of red meat. I think if you have lean, grass-fed meat, it'd probably be more neutral. But the thing about protein is that meat is has a very, very good profile. It's the one that really has enough protein to build muscle and build all the tissue you need. That's why you want to have some red meat once in a while if you can, especially if it's grass-fed. But for the most part, I'm not saying you should have a ton of meat, but don't be avoidance of meat. Have a lot of vegetables, of course, and fruit as a primary. And then, of course, fruit and vegetable intake, they are your messengers. They are there. It's called food information. The nutrients in the fruits and vegetables that you can't even pronounce, right? There's little weird long chemicals, right? Those particular foods go in there, go into your genetics, and they play a game, and they turn on genetics for longevity and anti-inflammatory. It's not the vitamin C in there, it's not the B12 in there, it's all the weird names, the quercetins, all the polyphenols, all those weird stuff that you can't pronounce. Those particular nutrients that are not necessary but beneficial are really important in influencing our genetic expression of all these longevity processes. And then, of course, intake of potential inflammatory foods, and this is probably, depends on the individual, where you get it from and how you get it from. For example, gluten in America is different than gluten in Italy. We all know that. I've heard the kid. You go have a baguette here, I gotta have a baguette from Safeway. Oh my God, I got some bloated. But I had a baguette in Italy or France. I had no problem with that. It goes to show you that the way it's processed is different. The proteins might be a little bit different. and the fact that don't have pesticides there. We have glyphosate, and it turns out that glyphosate may be one of the reasons why our wheat gives us trouble. But if you have it in Europe, they don't have glyphosate in Europe, they don't allow it in Europe, and therefore you don't see as much of a problem. So yes, there's celiac, and there's gluten sensitivity, but is gluten sensitivity because of gluten, or is it because of the process or some of the other things about it, like the glyphosate that's in it as well? So it's hard to know. Dairy can be problematic for some people, especially the casein, like milk. Nightshades are tomatoes, potato, eggplants, and peppers. I see that often causing joint pain in a lot of people. Tomatoes can cause joint pain. And then, of course, high carbs. So those are potential. Doesn't mean that they are a problem. Doesn't mean that they're all bad. I'm just saying individuals who are sensitive, it could be a problem. Preservative, artificial food is, of course, very important. We know about that. Medication effect, we already mentioned that. Affects nutrient absorption, causes nutrient depletion, and it actually causes a gut barrier. We know that, for example, oral estrogens, for example, like oral birth control, can actually disrupt the microbiome. But if you take a transdermal patch, for example, like in menopause, doesn't cause that, of course, because it bypasses the gut, right? So, not a bad thing, just something to be aware that these things can have negative consequences. And of course, the big thing is GI health. All this can affect your gut, right? And what can cause, so the effect of food, the effects of stress, environment on gastric function, the microbiome, which is all your bacteria, how that influences your gut, how it influences your immune system, the gut barrier, which is supposed to be kind of pretty shored up, it often gets leaky, allows foods to get in and cause inflammation, and all that stuff can affect systemic health. So if our gut isn't healthy, it tends to create an inflammatory response, which we'll talk about in a minute, which creates a whole host of not just gut problems, but systemic. I feel fatigue, I get rashes, I get non-specific histamine symptoms. All that can be purely from gut. That's one kind. Exercise, and Ryan knows about this. She's the expert in exercise. We all know that too little is deconditioning. I don't think the second one is really a problem here, Ryan. Although Terrence, but in general, I think most of us are in the first one, right? So what happens with exercise? We all know it's a great thing. Exercise, both cardio, whether it be HIIT or Zone 2 or whatever, they all have shown to have benefit. And of course, resistance training, which is really important for a variety of reasons. And of course, flexibility and balance training as we get older. All those factors are really important in creating. I mean, why is exercise so good for us? What does it do? I mean, I feel tired. That's a good thing. What doesn't kill you make you stronger, right? And the idea is you're putting a little bit of what I call low-level stress on your body. So you're kind of creating a little bit of metabolic stress. You're creating a little bit of free radical stress, and that causes your body to go, hey, that's a bit of a problem for me. I better be ready for the next go-round. So it turns on your genetics to reduce inflammation, to improve your metabolism, to improve your muscle strength and bone strength. Because it thinks that in the long term, there's going to be a bigger problem, like a bigger storm is going to come. So it's called reinforcing, right? That's what exercise does. But you may have seen guys who do overtraining syndrome. Like I had some gentlemen a couple guys who came into my clinic who were doing men's health stuff, and they were like young guys, they were like in their 30s, and they were like, they were training, working their asses off on the week, weightlifting, strong, but they had chronic fatigue and they had like low testosterone. I said, well, maybe you're overtraining. Maybe you're overdoing it and your body went under so much physiological stress. What is it going to do? Well, I'm going to turn off my testosterone. In women, I'm going to have no menses, right? I'm going to pretty much be amenorrheic because the body says, I don't want to reproduce when I'm under a lot of chased by a tiger, right? So the tiger is overtraining, right? So what happens is guys lose their testosterone, women lose their estrogen and their progesterone. Progesterone goes first, estrogen goes second. That's why you see PMS. So I think it's really important to know that what am I overstressing my body, which can be a problem. So those people, you have to sort of back them off a little bit. I said, are you sleeping well? Are you taking time off? Are you like doing weight training more than every 48 hours in the same muscle group or less? All these things you have to think about to make sure that they're not overtraining. Because it creates a physiological stress, which we'll see what all that is. Environment. This is something we can't see, but we know it's there, right? We can see we can get everything else, we get it. We can't see it. Pesticides, herbicides, and other persistent organic pollutants. There's a higher incidence of Parkinson's disease in the Sacramento Valley. Why? Because of herbicides. Well known. That's why you see it, right? It doesn't mean that's the only factor. It's not, but it is one associated factor because it can create those pesticides, herbicides are mitochondrial toxins, and Parkinson's is a mitochondrial disease, like many things are. So like, wow, maybe I should go organic. Maybe I need to be a little bit careful about what I'm eating. Clean, was it clean 12 or clean 13 type thing. Whatever's got a thin skin, like berries and all that, do organic. If it's got a tough outer skin, like if it's a melon or if it's cantaloupe or if it's watermelon, don't worry about it because it's thick, right? It's the thin skin stuff, like leads, for example, needs to be organic, should be organic. Now, what's good about California is we tend to be a little bit more rigid on that. We don't put as much, so compared to other states, but other countries don't even do much less than us by far. So just be aware that if you can get organic, and like Costco's got a ton of organic stuff. Organic raspberries, get the organic onion, get the organic lettuce. Why not? It makes sense. Heavy metal accumulation is something that you can see sometimes if you're like a welder. I've seen people with a lot of like lead toxicity with that. In the early 1960s, 50s, we had lead paint. Kids would choose lead paint. That became a problem. Lead piping, that used to be a problem, no longer a problem as much. But smoking, cadmium, smoking. So there's a lot of different heavy metal potentials. Mercury in fish, so get the small fish if you can. Smaller fish tend to be less bioaccumulative than big shark or big tunas. They tend to accumulate more mercury in general. But fish is good. I'm not saying don't, just be a bit mindful of that. Plastics are bad, too much alcohol, smoking, illicit drugs, even medications. Things you put on your skin, right? Less is more. More organic you put on your skin, the better off you're going to be. You're going, God, I got this rash, I have acne. But why is that happening? Because the topical stuff you put on your skin disrupts the barrier. The skin has a barrier like your gut, and if it opens up the barrier, bacteria can get in and you start getting rashes, right? So just try to keep a mindful of that. Not everybody's sensitive, as some people are. Cleaning products, black mold exposure, infections, and of course too much UV radiation. Those all are significant physiological stressors. And then genetics. Genetics, of course, I'm not going to spend too much time on. Genetics seems to account for maybe 20 to 30% of our health destiny. There are some conditions like Huntington's disease, which is really high. It's hard to avoid. A triple repeat, you have a whole bunch of things going on. But for the most part, even like you have ApoE4 times 2 for dementia, if you do an aggressive program, you can change your destiny. Even though there's like a 50% likelihood of developing dementia with ApoE4 times 2, at about age 90 or 85, when normally it's about 20%, but you can change that destiny with an aggressive approach. So it's not like it's immutable, because when you have genetics, they have to be expressed. And if I can do something to turn off the genetics, then I can go, or at least influence the genetics, I might reduce that risk. So it's good to know. It's actually a good thing, not a bad thing. Big one. How many of you would say, how many of you would say you wake up in the morning and you feel like you have refreshing sleep? I think this maybe a small percentage. You wake up in the morning, I feel like I did pretty good. I feel good. Ready to rock and roll, And I don't snore, I don't kick, I don't jerk, I don't wake up sleep apnea. I sleep 7 hours. I feel good. It's probably a relatively small percentage. People think they sleep okay, but not great. And as we get older, it gets harder. Because A, we have chronic things that can wake us up. And B, we have lower melatonin at night, so we don't get the deeper circadian rhythm sleep. So we start losing our deep sleep, we start losing our REM sleep, and that's where all the good stuff happens in our body. That's all repair happens in deep sleep. So we start seeing that our deep sleep shrinks, and our REM sleep shrinks. Our non-REM, our light sleep, stays the same. But those two and that's why we sleep 6 hours, not 8 hours, and that's why we have, because of deep sleep. And deep sleep is where we get our hormones, our repair, our anti-inflammatory, and if we don't get that, we don't repair. And that's a problem. And when people don't sleep, they have more stress physiology, as we'll see. And then lastly, I think this is part of the biggest, is emotional stability and community. I really think that is by far the biggest. People with depression, anxiety, post-traumatic stress disorder, emotional abuse, life stressors, work, financial, family, healthy relationships, those are the good things. Healthy relationships, joy, love, laughter, gratitude, giving, spirituality, cognitive stimulation, those are the good things. But really, there's so much physiology behind about emotional stress. What does your emotion affects your mind, affects your brain and your body? There's textbooks on how much it goes wrong. And we don't think about it. We just don't think about it. I'm stressed, whatever. Whatever. And I don't know, I have high blood pressure, my gut sucks, and I'm fatigued, and I'm brain fog. No, there you go. It's called the body keeps the score. The body keeps, so people will say, I don't really have anxiety in my mind. but I feel like I have anxiety in my body, right? Because the stress, you just adapted cognitively to your stress, but your body hasn't adapted. So all of a sudden you go, I wake up and I just get panicked. My heart rate goes up, I don't know what happened. How did that happen? Because there was probably some stressors when you unravel all this stuff and you go, well, yeah, I guess that was pretty stressful. Maybe I just dealt with it. You know, yeah, defense mechanism. But your body will keep the score. That's the key. So now, so that's all great. So what happens? Okay, so all this stuff, all these 8 categories, and all these crazy things we talk about, how does that affect us biologically? Because at the end of the day, that's what really probably matters, right? Laura and I were talking this morning about people's stresses, right? There's some people who can multitask forever. They can do a gazillion things at one time and feel great. Their heart rate is like 75. There's some people who do 2 things and the heart rate is 120. So it's not so much, it's how your body responds to your stress. It's not the stressor, it's your response to stress that matters. That's the key thing. And that's what enhanced physiological stress is, more than you should have. That affects, a little stress is good because it challenges your body, it makes it adapt. A lot of stress is damaging. And that is the key to most American lifestyle, compared to like European and maybe Japanese and other lifestyles a little bit more calmer. Their longevity is longer for a variety of reasons, but I think it's about balance in some ways too. I think it's about how they balance their lives, how their emotional balance is. And we have to work on that a little bit more. So I'm not going to get into too much detail on this, but I'll tell you this. There's a lot of things that happen in your body, a lot of physiological responses that happen in your body. Some will happen more than others depending on what it is. If you look at your chart there, if you look at the chart there, right, the 8 boxes, right, are the things we just talked about, up here, right? All this mumbo jumbo down here, right? That's all the physiology. But what's interesting you'll see, okay, all this on top is kind of hormonal. What happens when I'm stressed? The first thing that happens when I'm stressed is if I'm mostly stressed, that is. What's going to happen? Which hormone is going to go up?
Cortisol.
And what else? What other secondary hormone? Adrenaline, right? Cortisol and adrenaline, right? Isn't cortisol an anti-inflammatory hormone? Isn't that a good thing? Good, yeah. It is good for like 20 minutes, right? Imagine if cortisol was there for like hours and weeks and months and years, right? At a subcellular level. The body says, enough of this crap. I'm going to not accept you, and I'm going to lock my doors. And we got glucocorticoid resistance. So you can measure the cortisol level. You go, it's a little bit high. I don't know, a little high, maybe a little bit low, it's disrupted, whatever. But, things change. But, I don't know, I feel inflamed. I still feel pretty inflamed. I really feel inflamed. Should the high cortisol make me less inflamed? Aha, Mr. Wizard. Yes, if it's working. You've heard of insulin resistance, you've heard of thyroid resistance. The body's not stupid. The body doesn't like too much of one thing, it shuts the doors. Now you got glucocorticoid resistance. It's like you don't have steroids, it's like you've lost your steroid effect. But now you don't have the protective effect of glucocorticoids. She mentioned adrenaline. Adrenaline is inflammatory by definition. So now, in the beginning, when I have an acute effect, okay, whatever. I survive, I manage, I get going, and I do fine. But if I have this chronically, the net effect of all that is chronic low-grade inflammation. Even if your cortisol is high, your adrenaline is also high, which drives inflammation, and your cortisol is not working anymore. Right? So it's like if I got steroids, I probably wouldn't respond. Right? It's called resistance. And there's other changes that occur too, but that is, in a nutshell, that can be a reason why people chronically have low-grade inflammation. The other thing that happens is when I get too much cortisol, what does my blood sugar do? Go up or down?
Up.
It wants to go up, right? It's greater rock and roll. If I have long-term, cortisol stays a little bit higher. It says higher. Well, that causes my insulin to go up, and I get insulin resistance, right? So all of a sudden, people under a lot of stress start getting pre-diabetic, right? Or diabetic, correct? And the other hormones have to change. So my adrenal hormones is more than just cortisol. There's blood pressure hormones called renin, angiotensin, weird names, aldosterone, doesn't matter. But those long-term can cause more inflammation and more blood pressure. So the bottom line is, these hormonal changes can lead to more blood pressure, more osteoporosis, more inflammation, more vascular disease, bottom line, from just that alone. Now, line number 2. inflammation, right? You go, okay, well, we said that this could lead to inflammation, but let's say, for example, I had a gut infection, and all of a sudden leaky gut. Now you talked about leaky gut a little bit, and then a lot of your immune system lives in your gut. So all of a sudden now I have a situation where I'm getting all this weird food kind of going through, and the barriers aren't any good, and my immune system is responding. Now I'm getting this sort of alarm response from my gut, my food, that says, hey, this is not working for me. This protein, I don't recognize it, it's not been broken down well, it's weird, what is this, it's foreign, and it starts to attack. So now you get inflammation just from your gut, right? You go, so now if I have more inflammation for whatever the cause is, whether it be an infection or a trauma or a gut, I get more inflammation. And inflammation is good because we need inflammation to fight illnesses and fight infections. But if we have too much of it, it causes collateral damage, like a nuclear bomb. You show a nuclear bomb, you get what you want, but you kill everything around it. And when everything degenerates around it, that degenerative tissue becomes an inflammatory responder, like autoimmunity. It's like, oh man, he just killed my cells. And everything that's in the cell goes out of the cell. And it looks kind of foreign to me. Now it looks foreign. You've heard of the two, in lupus, you may have heard of the ordering test called ANA. ANA is anti-nuclear antigen. Anti-nucleus, isn't that in the cell? How is the body responding to a nucleus in the cell if the immune system is on the outside? It's because somehow the cells were destroyed and that nucleus escaped and the immune system saw it there and attacked it. Now it's responding like a bug, like it's a foreign agent. So you get less collateral damage, which causes more inflammation, and it makes you feel like you have an infection because the body cannot differentiate. Is it a bug? It's foreign. Is it what we call a pathogen? Is it a toxin? Is it a self-antigen that we didn't recognize? All that looks the same, and the body reacts to it. And then when that happens, the body produces all these free radicals, which are basically, atoms that have a free electron, which are like Pac-Man. They want to attack other tissues that have other electrons, and it causes more damage. So what happens is you have hormonal changes on one hand, which can lead to this, and you have inflammation in general that can lead from this, but also be its own thing, like we talked about. And at the end of the day, those two together lead to damage to cells. If I have too much inflammation, if I have too much free radical, we'll call it, that is going to, it's kind of like BB gun. It's destroying cell membranes, fatty tissue breaks down, mitochondria break down, and you get more free radicals, and you get this spiral cycle that ultimately leads to degeneration, cell degeneration. And that's kind of what all this, I won't go over this, but that's kind of essentially what all this was about. I kind of just did it more pictorially there, but that's all there. So all this stuff here we talked about leads to cellular dysfunction, like damage to your DNA, which has to be repaired, which is hard sometimes when you get older. You get the cell membrane, which is made of fat. That breaks down as fat. That's very unstable. C15 is not unstable. Omega-3s actually, which are in the cell membrane, are healthy, but they're very, very unstable. So they're very, very susceptible to too many free radical damage. So when people go, that's why if you look at fish oil, you'll see on the bottle it has like vitamin E on it, has an antioxidant in there. The reason is because it's very unstable. It's trying to protect it, right? And if it's exposed to oxygen, if it's rancid, it becomes unstable. And when you take something that's unstable, that fish oil is actually not good for you. It's actually worse for you, right? Whereas a saturated fat is less is actually not as unstable, and a C15 actually is more effective. That's why C15 can be helpful. Not to say omega-3s are bad; they're good, but just to understand that there's about a balance. You need omega-3s, but you need their stability as well. So if your body's under a lot of inflammation and breaking down tissues, that's not a good thing. And the other thing that goes on is that the workhorse of the cell that build energy, called mitochondria, they're very susceptible to free radicals. As a matter of fact, they produce these free radicals as part of its breathing and energizing. But if they're dysfunctional, there'll be more leakage, like things are leaking, like a circuit break. And when that happens, it causes more damage and it feeds forward in more damage. But at the end of the day, when you start to damage the mitochondria, if my gas tank isn't working, if there's no gas in my tank, my car, I don't care if anything else is working, my car isn't going to move. If you have no gas in your mitochondria, you can't orchestrate everything you need to orchestrate in that cell. You need energy to do that. And that is a cornerstone of most diseases, whether it be Parkinson's, dementia, whether it be migraines, whether it be whatever. At the end of the day, even osteoporosis, at the end of the day, the cells are not producing enough energy for however they got there. They're not producing enough energy and the cells begin to fail. and that's a problem. So our immune system is very, 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 it's very metabolically active. You know, the more, it shifts from burning sugar to burning fat on a regular basis, depending on if it's proliferating or it's quiet or whatever. So the more metabolic disruption we have, the more every system is broken down to include our immune system. And if our immune system is broken down, guess what? We get cancer, we get infections, we get autoimmune disease, we get all those things. And also we need the repair mechanism, the idea of like, you know, the janitor comes in and cleans your house. Well, that's called autophagy. I have all these old material in my cell. I gotta break it down, I gotta digest it, burp it out, and then basically rebuild it again, and rebuild some new organelles. Well, that's called autophagy, and mitophagy is the same thing for the mitochondria, and that's important. And the things that help that are intermittent fasting, low glycemic, a little bit of exercise, all the cool polyphenol foods like olive oil and all the quercetins and all the great things we eat, fruits and vegetables. Those help to repair our cells when they've been damaged. Because we do have a repair mechanism on a regular basis, but as we get older, as we're under a lot of stress, that gets impaired. So that's why the cellular stress that's enhanced will reduce that repair mechanism. And at the end of the day, what happens is cells start to break down. They get senile, called senescence. The cells, they're not zombie. They're zombie cells. They're like floating around. They're not dead, but they're kind of dead. You know. And what they're doing is they're not quite dead yet, but they're vomiting a lot of inflammatory mediators. That's why they call senescent associated secretory phenotype, SASP, don't worry about it. It's basically like those almost dead cells vomiting inflammatory stuff. Well, what it does is it vomits all over the floor and everybody around it gets sick. So all the cells that are around you start to die. So people are looking into biohacking, what they call senolytic agents, like fisetin and urolithin A, whatever, quercetin. What they do is they help to destroy those senescent cells, because you want those to die, but you don't want everything else to die around it. Because we want senescent cells to die, but they're normally doing that. But if they hang around, like a drunk at a party, he's hanging around forever, you want him to go home. You say, please, get him out of here. You know? So if all that happens, right, then of course you get chronic disease and accelerated aging. I know it's a lot. Does that make kind of some sort of sense? I mean,
The drunk guy really helps.
Yes.
Drunk guy. Really helps.
Yeah. So this one, what I would have you guys do, I mean, it'd be fun just to go home and say, okay, look, how do I feel? If I feel great, I feel great. But still, even if you feel great, because disease can happen over time. Just go through and say, well, gosh, I got chronic pain, I got some back pain, okay, whatever, I'll do the best I can with that. Okay, that's my physical stress load. Yeah, I'm on 3 different medications. Sounds like they do with my nutrition. Okay, I gotta look at that a little bit. Nutrition, I can do better on certain areas. I don't sleep well. I got emotional health is good. Genetics seem okay. I can probably exercise more. Circling those areas, okay, if I can work on some of those factors, I can reduce those arrows going down to that physiology, right? And if I don't continue to drive it, then the body finds a way to improve it, right, over time. Obviously, there may be some things you have to intervene on to sort of change that physiological sort of feed-forward system. But for the most part, if you're a relatively okay person, you don't need to do much more than just work on those 8 boxes up there. So where to start? So what we do, and which is what you can do yourself, is try to address, we kind of talked about this, try to address the primary lifestyle and environmental factors. There may be a few things that you circle, but you go, you know what, I think the biggest thing for me, I'm just under a lot of stress. Well, I just don't sleep, right? Find 1 or 2 primary things that are problematic. The ones that are getting like the 80-20 rule, the things that probably contribute 80% that you think. Don't know for sure, but you think. Work on those first. And then that contribute to the cause and or perpetuation of someone's health challenges. Again, using that slide as a guide, or that handout as a guide. And then we try to address and this is harder for you guys, but we would then say, what do we think are the primary biological factors? We talked about the hormones, we talked about inflammation, but in most cases, they're all intertwined. So if you work on one system, you kind of work on another a little bit. But if we can understand, like, oh, is it really inflammation, we think, or is it maybe like stress and hormonal, like cortisol? If we get an idea on that, then we can try to work on those also simultaneously. So we work a little bit on the biology here, we work a lot on the factors up here, and then we can add maybe a little bit of foundational supplements just to make sure we're getting what we need. Like for me, I think foundational, depending on the person, we're all different, but in general, like a high quality multivitamin mineral, a fish oil, maybe C15, optimized vitamin D are probably the most important things. If you're not getting enough fruit and vegetables, maybe getting a good high quality green food that's really organic, like Orgain, a really good one. I mean, just make sure you get what you need, but hopefully get that through food. And then that's it. That would be your foundation. That's all you probably need to get started, if anything. But then you build that, and then you work on the other two. So here's an example. So what would we kind of doing? Let's say, for example, someone comes in with emotional stress, anxiety, depression, and so on. This is all the emotional category, right? Very common. So we're going to say, well, we think that the emotional stress is doing a lot of stuff. But I think what that's doing, it's driving a lot of that. It's a brain thing. It's driving a lot of hormone, cortisol, adrenaline, brain stuff, okay? So what are we going to focus on? Well, I'm going to focus on things like in the lifestyle medicine things. Yeah, I can do a lot of things. But if there's one thing I have to choose, if I think the person's under emotional stress, yes, I can do elimination diet. That might work because it's all connected. But I might want to primarily work on mind-body work, vagal nerve stimulation, sleep hygiene, gentle exercise, walking, yoga. Kind of makes sense intuitively, right? If I think that that's where the problem's starting, if I want someone to be compliant, I can tell them to do a million things. But at the end, I go, well, what do I think is primary? Yeah, the gut can affect the brain, but the gut's okay for the most part, and they're mostly okay, but they're really telling me they just can't sleep and they're stressed and stuff. Working on that first. And then if I were to do any supplements, I would do supplements that's going to work on that. I might do, for example, magnesium, really great for the brain and calming. I might do theanine, which is a green tea extract. I might do a nice form of GABA, melatonin for sleep. And I might also do like certain herbs, like ashwagandha, magnolia, whatever. I would focus on those particular nutrients and herbs that are going to calm the nervous system down. But that would be that category. And that's a huge category if you think about it. That's like pretty much half the population right there. Another person comes in, I've got issues. I've got reflux, I've got diarrhea, I've got constipation, inflammatory bowel disease, blah, 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 right? So in those folks, I might do an anti-inflammatory diet. If they have just general symptoms, I might do a low FODMAP, which is a type of diet specifically for bacterial overgrowth. But I'm going to focus on the food and the gut, right? And then when I do the metabolic approach, I'm going to do specific supplements that are going to focus on like digestive enzymes, maybe hydrochloric acid, maybe some probiotics, maybe some gut healing nutrients like glutamine and licorice, whatever, it doesn't matter. I'm going to do those type of things that are going to focus on the gut. Yes, do I think the brain affects the gut if they're under a little bit of stress? Yes, but if that's their primary complaint, if I do a symptom thing, I say, what's your main one? They'll say, well, I have this, but this is my main one. I'm going to target that first because I want to make sure that they're compliant. So you think of yourself the same way. Well, if my main thing is my gut, then let's work on that first, right? And then what about the metabolic patient? Someone comes in with hypertension, lipid issues, central weight, right over here, obesity, right? Called the insulin resistant, the pre-diabetic, diabetic patient, right? They may have other things going on. I've got back pain. Okay, but that's my major concern right now. That's the thing I'm most concerned that I'm going to focus on that. So metabolic. So on the dietary program, I'm going to give them a lower carb, like a modified Mediterranean diet, like a Mito food plan. I'm going to do time-restricted eating and exercise. I'm going to do aerobic. I'm going to do time-restricted. I'm going to do resistance training, all that stuff. I'm going to focus on the life. That's the lifestyle medicine I'm going to focus on. Now, the caveat. I will ask about their sleep because I know that sleep, if they have sleep apnea, is a huge trigger for insulin resistance. So I might just kind of dive in a little bit on the behind the scenes and say, how's your sleep? I'm going to always ask about everything. But if I think that that's a problem, I'll address it because that's important. But in general, if people lose their weight, then sleep apnea goes away too. Even it could be as little as 5 or 10 pounds, right? So that's important. But I will make sure that sleep is an issue as well. And metabolically, I'm going to do some supplements. And if I'm going to do supplements, I'm going to focus on those particular ones that are going to help with like natural GLP-1s. I might do, for example, I might work on the microbiome, which is really important for that. I might do things like berberine and bergamot and chromium, all the things that help with blood sugar management and lipid management. I would focus on that because that's the major concern they have in that category. And what about that? There's like non-specific stuff. These are always the hardest. Oh God. Brain fog, joint pain, chronic fatigue, fibro, achiness, skin up. Real big problems. What do those have in common? They probably have low-grade inflammation. just like, I just brain fog, I just don't feel right, I feel like I'm really achy. So I said, okay, so what is the best way to attack generalized inflammation? Well, there's many ways, but the thing that we, functional medicine people, jump to immediately is that gut effect. So we might just jump to the anti-inflammatory diet first. And we get good benefit with that. We've tried to see if whether or not, because we know that the gut contains 70% of the immune system is in the gut. That's why I was like, why the gut? I don't get it. There's so much immunity around the gut for obvious reasons. And if that's disrupted, it's going to cause a huge barrage of effects. Like, for example, they found that people who went on a gluten-free diet in America had lower thyroid peroxidase antibodies for Hashimoto's, right? Their ATPOs went down, implying that, wow, there's probably a gut immune effect. Not everyone, but in some people. So I would do an anti-inflammatory diet for several weeks, maybe a little bit longer, and then see how they respond, and then add things back and see how they do. And I would do very condition-specific nutrients. I would do, like, of course, fish oil, which we already have, turmeric, PEA, palmitoyl-ethanolamide, a really, really good supplement that I really love. It is one that has so much great data on improving inflammation in the brain, improving the body's normal, we'll say, cannabis system that we have. We have our own. It actually improves our own, and it reduces inflammation everywhere, both in joint as well as brain. And we're looking at PEA for Alzheimer's, Parkinson's, because of how it affects the brain. Very, very good. And we make PEA, but it actually goes down over time. And when you look at actually during stressful situations, during inflammation, our bodies actually ramp up PEA production, right? So it's like, there's something about that, it's doing it. So we need to augment that, because it tends to be low. So focus on that, we start to there. And then people who have chronic degenerative diseases, like cancer, dementia, Parkinson's, and so forth and so on, they have a lot of sort of this free radical stress over time. Yes, there's inflammation, but there's like the mitochondria is being damaged, there's free radical stress going on. And so that is a little bit more of a complex issue to deal with. So I'm going to do a lot more things, but I'm going to probably still try to do, there's data showing that if you implement those folks with, let's say, a ketogenic diet or a very low glycemic load diet, you can see an effect on their brain function. Like Parkinson's patients can get improved motoric function on the motor score, Uniper's motor score, by doing a lower glycemic modified Mediterranean diet. We know for dementia, modified Mediterranean has all the data in the world. The Mayan diet, which is basically like the Mediterranean diet, is really good for brain health. I want to make sure there's no environmental toxins, go organic. I might do an environmental toxin test on their urine or the fat to see what's going on there. And of course, gentle exercise. I would just try that first. I mean, there's a really very aggressive protocol called RECODE protocol, R-E-C-O-D-E, created by Dr. Dale Bredesen, which is a very highly aggressive lifestyle program that looks at every element that we talked about and more, like chronic infections and hormones, and says, we're going to throw the kitchen sink at you because you need the kitchen sink. If I give you just a little bit of this, if I give you one drug, good luck. You're only going to get this far. But if I throw the kitchen sink, you're going to cover 38 holes, not just 2 holes in the ceiling. So, and he did studies on this, and they found that if you use that aggressive RECODE protocol, people get certified. We didn't get certified, but people got certified on it. You can actually see not only arrest, but you see improvement of mild cognitive impairment. Not advanced dementia, of course, but MCI. So people are like Joe Biden, MCI, right? See those level people, they're having, if you hit him right early on, he might actually improve. Not only would not get worse, but he might improve. Okay, yeah. So, and we would really focus on the type of things that I would focus on in those folks are things that are going to protect the brain, protect the mitochondria. You've heard of CoQ10. You've heard of things like glutathione, PQQ, all those weird quercetin, all those weird new stuff. Throw it at them because they need it. They're going to need a lot of stuff. Do they all work? Some kind of work, some do. I mean, probably not in isolation, maybe a little bit, but I think if you just think of it from a holistic, comprehensive perspective, you might get some effects, especially if done early on. And now what's interesting about dementia, there's a blood test that's been FDA approved, 2 blood tests that are FDA approved. So you can see LDL changes probably within 5 or 10 years even before any symptoms occur. And then now they're looking at studies on the new infusion, the new MAB that's out there, that actually helps anti-amyloid MAB, that if you take it early, you might even like prevent symptoms much, much further down. But again, it's hard because it's not that it absolutely, having amyloid doesn't necessarily absolutely mean that you have dementia. It's like saying, I have the ash after the house was burned on fire, right? Well, ash is like amyloid and tau protein, okay? It's there. But is that really the cause or the effect? Because they did a lot of anti-amyloid type of stuff before, and they found it wasn't effective. And even in this studies, the mob is only like 20-30% effective. So what you have to address is, again, what made more amyloid? And the things that make more amyloid, guess what? Inflammation and oxidative stress. Right? If people are under a lot of emotional stress, you'll see their brain shrink. You'll see there's more amyloid production. So the idea is if you can go backwards and say, okay, what are the drivers of that? Because then if I can improve the mitochondria, if I can improve brain inflammation, then the amyloid will then not accumulate. And then I can also try to do things that remove amyloid as well while it's there. So it's not just enough to remove amyloid, you need to do the whole thing to really get a benefit. So that's what's being done right now. And then lastly, like conditions like, hormonal. So hot flashes, low libido, osteoporosis, thinning of skin, muscle loss, typically seen as a result of age-related or disease-related hormonal decline. Typically above the age of 35, 40, 50, you'll see that. And those folks, what I really want to do is just try to understand is the hormone decline because you're overstressed, or is your hormone decline because maybe you're just getting a bit older, maybe you got some medications, you're on this and that, and we just need to look at that. So what we do is lifestyle is very basic. Keep people on a lower glycemic, healthy, anti-inflammatory diet. We get them on a normal exercise program, and then we actually work on things that restore hormones, either by giving hormones or giving herbals or nutrients that optimize their own hormones themselves. So as you can see, we're just trying to focus. I mean, obviously we can do a lot. A lot of times we'll like vomit on a sheet, tell me to do everything, and think, oh my God, there's no way. But if I say, okay, let's start with this, because this is the primary problem, then you can go, hey, I feel a little bit better, this is great. Great, let's now move, let's go up a little bit more. And then when people start seeing benefits, they get excited. Even small gain, they get excited. They want to do more and more and more. But if I throw the kitchen sink at them, they get frustrated. Like if we go to an exercise program. Someone says, I want you to do weight training 5 days a week, and this and HIIT training, and you're going to go nothing, not going to do anything. A New Year's resolution is going to last an hour. But I think if you just start slow, go low, go slow, like here, people tend to get benefit, they tend to be excited, and they tend to want to get more, because they want to continue feeling better. So, conclusion. The traditional medical approach is best for managing acute problems that we talked about, that utilizing interventions designed to get patients out of harm's way. That's great. ER stuff, great stuff, great stuff. We're the best in the world. Functional thinking is the most effective method for disease prevention and chronic disease management, as you can see why. Functional thinking identifies the crucial lifestyle and environmental factors that contribute to enhanced physiological stress, which is what you have in the handout, and thus the health challenges, all the while keeping in mind the biological consequences of these abnormalities. And it's important to note that if I have chronic fatigue, doesn't mean my chronic fatigue is the same as someone at Lynn's chronic fatigue, for example. They're going to be different, right? The reason why I got there will be different than the way Lynn got there, or Laura got there, or whatever. It doesn't matter. So we have to understand that we have to personalize it as much as we can. And it doesn't take that much time. A lot of times the patients themselves, they have this information. People are very smart today. With AI, they can kind of figure out more or less what they need to do. This gives them some guidance on how to figure it out. And then functional thinking creates a treatment strategy, again, that focuses on restoring healthy living, lifestyle medicine, and healthy biology, metabolic medicine, with lifestyle medicine being the most critical piece. If you don't take any supplements, that's fine. If you if you start walking, and you start doing all the right stuff, most people are going to feel better at some point. They do the rest, as long as they identify the problems that are real and they're honest about them. And these are some references, resources. You can take a peek at my book there if you want to look at that. These are all the references I think are really helpful for people if they want for more information. And